The city of Ferris, about 25 minutes south of Dallas in Ellis County, approved a plan to bring free basic health care to every one of its residents. The city says it will not only improve the health of its citizens, but also the health of its systems. Fox 4 Sean Rabb examined the free health care idea and joins us live. Hey, Sean.
And good evening to you. Let me tell you, it's not socialism, okay? It's not government health care. No one's going to be asked about insurance or income. And as best that we can tell, this is the first municipality in Texas, maybe the nation, to figure out a way to provide basic medical attention to each one of its residents free to them.
It will. It'll change healthcare in Ferris. We think it's a model that other cities and counties can use.
Approved by Ferris City Council Monday night, called Access for All.
That's going to provide basic telemedicine and virtual medicine along with a mobile component to every single citizen that resides in our city limits.
The idea of free basic health care to all coming out of the city's response to COVID-19 when it partnered to stand up a monoclonal antibody treatment center.
We've offered monoclonal antibodies to all the residents of Ellis County throughout the COVID pandemic, treated over 4,000 patients in the county.
Dr. Dirk Parrott is president of MD Health Pathways and an emergency medicine physician. Pathways will use full-time and contract doctors, nurses, and paramedics to provide basic health care to folks who call Ferris home.
We want to provide that access to care that maybe doesn't need the level of care at an emergency department, but because nothing else is open, that's where you seek your care.
Ferris sits in Ellis County, one of 60 Texas counties without a public health department.
We had 6 suicides in our city over the last year. That's 50% across the whole county. We care about our people. We want to provide a mental health component to this, a physical health component. We've got 40% of our population that is under or uninsured.
Williams says free access for all can pay off in other ways. Ferris schools, for example, get $35 a day from the state for every student in class.
The RISD averages about 110 kids absent per day. If we can make a 25% impact on that, that's $200,000 to our ISD.
20% of 911 calls for Ferris paramedics are non-emergency calls.
Ferris Police and Fire Department.
Access for All can now handle, in theory, saving the city money. Ferris will use American Rescue funds to pay MD Health Pathways to provide this basic health service. $55 a year for each of its roughly 3,500 citizens.
This is not about doing something where we ask for more money. This is about using dollars that are already available and reinventing the public health system.
Really interesting. Now, the city manager says there are also grants out there, state and federal dollars, that they're already starting to apply for so they can sustain Access for All after the first 2 years that's being funded with the COVID relief dollars. Going to take them a few months to stand the program up, but Clarice, we plan to go back for checkups to see how it's progressing, but it's really intriguing.
Going back for checkups, indeed it is, and we'll look forward to those follow-up reports from you, Sean. Thank you.